So there are many jokes about the kidney and the renal stones. It seems one kidney in a body said to the other when that kidney got sick, "Don't worry, pal, I am there. I can get along very well without you and keep this machinery going. After all, we are not indispensable, we are replaceable." And then it seems people say when there's a lot of problems in life, they'll say, "Don't worry, this too will pass." Just like that kidney stone, which gave you a hell of a time and moved out so smoothly, this too will pass. Well, these are just jokes. But the kidney is a vital part in our body. It maintains the balance of your body, your hypertension, your hormonal levels, your diabetes, so many things. It removes the toxic garbage from your body and maintains the balance in your body. And that's why we have a very eminent speaker, Dr. Kenneth Wu, all the way from Malaysia across the seas to be with us here and to enlighten us about how to maintain and take care of our kidneys that God has blessed us with. So I won't take much of his time. We're all eagerly waiting to listen to you, Dr. Ken. Before that, can I call upon Dr. Meghanathan, another CMC alumnus who knows Dr. Ken very well, to introduce Dr. Ken to us? Dr. Megha, can you take it from there?
Thank you, Dr. Hansa. It's a great privilege for me to introduce Dr. Ken Wu. He is a doctor, author, speaker, and reviewer of medical journals. Dr. Ken Wu is a consultant nephrologist and consultant physician, and he was trained in the United Kingdom. He passionately motivates his patients and readers because he believes the message of hope is a powerful medicine for the heart. His unique ability to integrate medical information with life inspiration is demonstrated in one of his inspiring books that's available, and it's called Life is Short, Keep Shorter. And there's a free link for this as well. The preview chapter describing hypertension is also in this book, and it can be downloaded for free. Now, may I invite Dr. Ken Wu to give a talk on kidney disease, kidney failure, diabetes, and hypertension. Thank you, Dr. Ken, for taking your time and coming to give us this talk. Now I hand over the floor to you, Dr. Ken. Dr. Ken, it's all yours.
Okay. So let me just see. If I can just ask, where are you guys from? If you can just type on the comments, and so on. Who are you and so on? That for 15 seconds. So the more comments I see, the more inspired I am. So I'm going to tell you. Good morning, good afternoon, good evening to all your kidneys. Okay, look after them. God is very, very gracious. He has given you a pair. He even give you a spare part, all right? Because you can survive with one kidney only, and yet God has given you two. That is how generous God is, right? So we're going to talk about this, and as I share this, I'm going to try to see to make the connection between all of you. So you can ask me questions later. There'll be tons of questions. Usually, people are very, very interested to know all the different details, and you may have some personal questions that you want to ask me as well. But yeah, so in basically whether it's in England, the UK, or Borneo or India, the way to take care of kidneys are just the same, right? Okay, let me show you that. So the top causes of kidney failure in Malaysia, in India, in Asia, and worldwide is diabetes. Secondly, is blood pressure. So I'm going to talk about blood pressure first very quickly. You guys look super intelligent to me, although I can't see all your faces, but I can tell you that you guys know a lot about general medical health knowledge. So I'm just going to go through this very quickly. So the medical name for high blood pressure is hypertension. Okay, what is the normal blood pressure? Can someone just shout out the number? 120, 80, is that normal? Or 140, 90, or heart failure? Can someone just shout out?
120, 80.
120, 80. Well done. That's correct, right? So it's 120, 80. Although 130, 80 is still acceptable most of the time for most of us when we are doing our regular exercise. Sometimes there may be a need for us to really check our blood pressure after we have exercised. If it persistently stays high, then you probably need to pay more attention to it. So 120, 80 is ideal. If you're an international football player, you should be expecting the blood pressure around this number, right? And then, so most of the time, we can actually delay the onset of high blood pressure, even if you have a strong family history of high blood pressure. So if your father and your mother and your brother and your sister, they all have high blood pressure, if you can cut down on salt intake, if you can cut down on your sodium intake, you can delay the onset of high blood pressure. You may even be able to avoid in your lifetime. So it's very, very well documented, well studied now. So one of the key things to do is to make sure that we do not take too much sodium in our diet so that we can delay the onset of high blood pressure. And then these are the beautiful, wonderful, delicious food that we all like to eat, right? Ketchup, vegetable, juice cocktails, eat up breakfast pasties. All this stuff can be taken in very moderate intake, right? So moderation is the key. Don't take this all the time, and make sure that you have a balanced diet. That's the key thing, right? And let me just go. So let me move it quickly first, and then I can talk about kidneys in 2 minutes. How common do you think is diabetes in India, in Asia, in Malaysia, in general? Very common, yeah. 5% or 20%?
20%.
20 plus.
20%. Right, okay. When the teacher wants to help you, he only give you two options, okay? So the answer is 50-50. Chances are you will still get, even if you guess you don't know the answer, you might still get the answer, right? So it used to be 20%. Then we have a lot of cases now what we call pre-diabetic. And sometimes 30%, 40% is actually reaching out to easily 40 to 50% in some countries in Asia. So it's no longer a Western problem. It's actually a global problem. And we know that the number one cause of kidney failures, both in India and Malaysia, is diabetes, followed by hypertension. Most people have both, right? And these are the symptoms that you usually see. Sometimes you may absolutely have no symptoms. This is what we call asymptomatic, meaning no symptoms at all. Nocturia means you wake up at night, you keep going to the toilet to pass urine. That is one of the symptoms. The other one is polyuria, meaning you are always going to the toilet. Polydipsia means you are always thirsty. And sometimes you have all these non-specific symptoms like headache, blurry vision, and what we call asymptomatic. You sometimes may not have any symptoms at all for diabetes. So the reason why we need to talk about this is because they are all interconnected. Kidney specialists, kidney doctors have to deal with almost every system. Diabetes can affect your heart, your kidneys, your blood vessels, almost every organ in your body, right? So diabetes can cause kidney failure, heart attack, stroke, amputation, blindness, and important many, many things, not just one complication or two, many, many complications. And then, so what is the best prevention for diabetes? The answer is, anyone want to guess?
Obesity control.
Yep. Anything else?
Exercise.
Exercise, very good. One of the things that you can really, really do and reduce your chance of getting diabetes is really doing 2.5 hours of exercise per week. That is moderate intensity. So that could be as simple as brisk walking. Okay, brisk walking is different from leisure walking. If you are only walking and you are not are able to complete the sentences or have a conversation, that is the kind of speed we are talking about. If you're on the treadmill, you're walking, you're doing brisk walking, we want to see you walking and not being able to sing or have a conversation. That is what we call brisk walking. Fast enough. You can start first with a little bit more of my slower pace, but eventually you need to pick up the pace so that you can actually have some quality exercise. So brisk walking is as good as running. You do not need to run all the time, right? The other option is, of course, swimming, cycling. You know, if you are watching your television, you're listening to your latest sermon, you are listening to a particular podcast, you can cycle. Stationary bike, very, very helpful, especially for those who cannot do vigorous exercise, right? So let me put that. So let's focus on the kidneys now. So we are coming to that. We know the two major risk factors. If you can reduce the number of kidney failure, reduce the number of hypertension and diabetes, you can definitely reduce the number of people that end up needing the dialysis machine, right? So the function of the kidneys is very simple. It regulates the blood pressure. It helps you to make red blood cells. It excretes waste products to remove excessive water. And the cause of kidney failure, we have talked about it now, and I'm going to talk about stones in a minute, right? Okay. What is this?
Stones.
Do they look like brown
Kidney
diamonds
stones.
to you?
Kidney stones.
You sure? You don't think they are brown diamonds? Painful diamonds to have in your kidneys. These are very, very painful diamonds for you to have, right? If you don't drink enough water in Asia, in India, in Malaysia, what will happen is you can develop this kidney stone. So one of the very, very important way to prevent you from any kidney failure is to actually drink enough water. If the kidney stones is small, no problem. You might be okay and get away with it without needing any kind of intervention. If it is blocking the central part of your urine passage, then we have to do something about it. Okay, so you don't have to be frightened about every kidney stones. There are times that they are small enough that we can just observe and leave it alone for many, many years. But the key thing is to prevent more stones from being formed. If you can, you try your best to drink enough water. Right, let me see this. Okay, so how to avoid complication? Okay, control all these risk factors. We are talking about stones, we're talking about high blood pressure and diabetes now. So the other things that many people in Asia like to do is they like to go to the pharmacy, purchase over the counter products, and they like to try a lot of unverified supplements. These are the things that you need to be careful of. Sometimes when it is unverified, they say it's good for you. It will make you look young forever. You may live for 200 years old. When it is too good to be true, be very, very careful. One of the key things that we need to be careful of is painkillers, right? So these are the things that you need to watch out for. And apart from stones, diabetes, and high blood pressure is unknown, unverified drugs. These are the common drugs that can cause kidney failure. They are usually purchasable over the counters, both in Malaysia as well as in India, I believe, right? I do not know. Can you get these painkillers over the counter? Is in India?
Yes, I think ibuprofen and diclofenac, we can get it over the counter, right? Am I right?
Yes,
In
yes.
India?
And
Yes,
many
yes.
more tablets. Yes.
Yeah.
Yeah.
These are the things that we have to be very, very careful of. Even in England, you can still get this. If you are about to board the plane, you look at the shop there and they can sell this. If you buy too many boxes, then they'll give you a funny look. And then they will start asking you lots of questions, but they will still let you purchase them. So that's the issue there. So very often, many people take these kind of painkillers and over the counter because they have gout, they have migraine, they want to control their pain, so they will just purchase it. And if you keep buying these tablets day after day, because they are cheap, they are effective, many people rely on them. And these are the painkillers that we have to be extra careful. If you take it long term, there could be serious consequences. All you need to do is to follow the doctor's prescription. If they say take 1 day, 2 days, 3 days, fine. You are unlikely to have problems. If they tells you not to take long term and you end up taking it, this is where problems will begin, right? Okay, so it's important for us to understand once we have the problem of kidney problems in the country, guess how many new dialysis patients? So dialysis in general, we used to have 2,000 patients per year in Malaysia, then become 4,000, 5,000, 6,000. We have now seen new dialysis patient, about 10,000 of them every year. So this is not a good news by any stretch of the imagination, right? If you look at Singapore, they are also facing the same problem. So I believe in India, it will be the same issue that we are facing as well, right? So total dialysis patient, we are seeing in East Malaysia is literally 1 to 2 cases every day. And we think it is an underestimated figure, because many of these people will not make it to the hospital. They may just suddenly die because of kidney failure at home without them even realizing. Kidney failure is a frightening thing because it is not like heart attack. You will get shortness of breath, you get heart attack, you will get pain, you will get chest pain. But for kidney failure, usually you do not have any symptoms until it is very, very severe. That is why doing blood tests and urine tests is important, right? So the best way to prevent kidney failure, to cure kidney problems, is prevention, prevention, prevention. Education, education, and education. So tell them from time to time, if they have diabetes and high blood pressure, they need to get their blood test and urine test checked regularly. So if the doctor asks you to come back every 3 months to 4 months, listen to the doctor and make sure that you adopt healthy lifestyle. And the other thing to understand is it is not just about adopting healthy lifestyle, but also spreading the news, making other people aware of it. Because dialysis and transplant are way too expensive. You will not be able to support it as a nation. Even if the government is willing to pay for it, you will not have enough people to be able to support the GDP. Because when too many people in the country has heart problem or kidney problems or cancer, the person, instead of being able to contribute to society, the person will now need to be taken care of by society. That is why it is important to adopt healthy lifestyle. In some way, this is what we call health economics. It is much better to prevent them from getting sick rather than trying to rectify the problem when the health is broken, right? So far, let me ask you, do you have any questions? Can you hear
If
me?
there are no symptoms for kidney disease, how do
Yep.
you know? I mean,
Oh,
normally you will do a blood test, but
yep. Yep.
you
Blood test, urine test.
urine test, okay.
Blood test and urine test. So important to realize 3 things, all right? Control your blood pressure well. Make sure you check it regularly. Control your cholesterol well. And control your glucose well. If you do so, even though you have diabetes and a little bit of mild kidney impairment, you can still keep going for many, many years. The kidneys can still support you for many, many years. So in other words, you take care of your body, you take care of your kidneys will take care of you.
Is water intake a factor for kidney health?
Yes, sufficient water is important. So roughly, if you ask me, I will tell you, okay, per day, you try to drink at least 1.5 to 2 liters for an average person. When I say 1.5 to 2 liters of water, I don't mean a cola. I don't mean soft drinks. I don't mean latte. I mean pure water, right? Okay, just normal water. Important part to realize is it depends on your activities as well. If you are a roofer, you are fixing the roof every day under the hot sun, you know you need to drink more than that. This is to prevent you from needing any surgical procedure later when you develop kidney stones. So drinking water is an important part.
What about green tea?
I think again I started off everything in moderation. Okay, green tea does not harm you. Okay, but you should try to control. Don't drink too much of green tea. There is a particular stones that they are called calcium oxalate that can be formed if you drink too much tea. So it doesn't matter whether it's green tea, blue tea, black tea, white tea, whatever tea, make sure that you don't drink excessively. That's the key thing, right? Moderation is the key.
How about
What?
alcohol?
Alcohol, I see. Right. Um, again, you must understand there are all kinds of studies out there. Alcohol, whether it's good for you, again, I will again say try to keep it to the minimum if you can. In general, it is best to avoid if you can, right? Especially for beers, all this, they have a lot of calories, right? And I have a lot of patients who are diabetic. When they drink beer all the time, they will gain a lot of calories. The belly will be very big. And then if you end up using a lot of drugs to control the diabetes, the glucose. So it's best to keep it to a minimum, okay? I know all kinds of people who say this Japanese alcohol is good and that red wine is good and so on. In some way, some of the studies do not always support that it is a good idea, right? So if you can avoid, if you are not someone who drinks alcohol regularly, you are not missing much, okay? You're saving a lot of money.
What connection does potassium, high potassium, have to
Yeah.
do with the kidney disease, and how can you bring this potassium down?
Okay, so potassium, okay, in general is a salt in your blood, okay? We have sodium, potassium, phosphate, all kinds. There are multiple salts in your blood. So potassium is one of the salts that tends to be elevated when you have kidney failure. So the more kidney function that you lose, the higher the potassium will increase and be elevated in your blood. So when you do a blood test, you will see high potassium. So the way to do this is to avoid taking too much potassium-rich food like bananas, like Nescafe. Those things are going to elevate the potassium. So we generally ask the person to see a kidney dietitian, and then they will go through the diet with the person. So potassium does not damage the kidney, but potassium is elevated when you have kidney failure.
You've been talking about diabetic and kidney. Is blood pressure also related to kidney in any way to be more dangerous?
Blood pressure related to kidneys. Yes. Prolonged hypertension, prolonged high blood pressure will damage the kidneys. So it is the second most common cause in Malaysia that cause kidney failure.
How do we avoid? Because many patients who have sugar also are diagnosed as diabetics. It's like, brother sister going hand in hand most of the.
Yeah. So what the good news about high blood pressure is most people can have their blood pressure control as long as you take blood pressure tablets every day. You must be consistent and regular. If it is in the morning or at night that you remember to take a tablet, make sure you take it at the same time. So making sure you check your blood pressure regularly and making sure you take your tablets is the key thing. Blood pressure is easier to control as long as you're sensible with your diet. Glucose, on the other hand, takes a bit more effort. Sometimes a lot of people take too much of carbohydrate. So when they take too much of carbohydrate, like bread, like rice, like noodles, these are the things that will increase the glucose. And then this is where a lot of the diabetic patients need to take like 4, 5, or 6 diabetic medicine. So again, controlling diet and taking the right medicines. Not taking a lot of medicine, but taking the right medicines.
How about salt intake in hypertension?
Yes. Salt intake, if you can keep it, as I say in the first slide, if you keep it to moderate, okay, you keep it to a sensible intake. In my book, if I can show you the link later, you can go and read there, the amount there. If you can keep it to a regular intake, you will find that it is a small enough amount. You will find that your blood pressure will decrease. If you do not do that, what will happen is your blood pressure will become very high and you will need multiple tablets. Cannot
What
see
is
here.
the relationship between the salt and hypertension?
Yep. Salt basically retain more water, more fluid, especially if you have big legs, you have swollen legs. A lot of times we will ask them to watch out the salt intake, and then they will retain less fluid and the legs will be less swollen. That is one of the relationship and one of the mechanism where you actually elevate the blood pressure when you retain too much water.
What's the maximum amount of protein that you can take per kilogram per day, especially some of us who are on a low carbohydrate diet? We rely more on the proteins and the fat. So, what do you think is 1 kilogram per kilogram the advisable thing, or 1 gram
1
per
milligram.
kilogram?
Yeah. Yes. Again, depends on your mechanism. Depends on how you actually exercise your activities. In general, it is better to take protein than carbohydrate if you can help it. Chicken breast, for example, is one of the best one. Fish is one better than red meat if you have to take. But again, if you have to take beef, you have to take mutton. All this is not a problem. But in general, yeah, roughly around 0.8 to 1 and per kilogram. And then the key thing is also to see and make sure that your kidney function is okay, right? And if you have severe kidney impairment, your kidneys and your liver are not able to process it well, you will have to actually talk to your dietitian and see how much you need to reduce it. But in general, we encourage people, those who are malnourished, not to control too much of the protein intake because we are more concerned about malnourishment. So in general, yeah, you're right. 1 is the correct one. And if you are a bodybuilder, you know, you will need to take probably more than that, depending on what day and when you do your workout as well. Your gym instructor usually will give you a plan, right? Just to let you know, this is the kind of diet that you should not be having every day. I once went to Scotland to present my work, right? And this Scottish lady was very friendly to me. She thought I was from America. And then she asked me, "Where are you from?" I say, "I'm from a place far, 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 far away from here." And she was so kind, she showed it to me. And it's not 1 egg, 2 eggs. Look at the bacons, look at the bread and so on. If you take this, you should expect to have problems if you take this regularly. Once in a while, I'll tell them, yeah, okay, this is okay. You can break the rules maybe once a year, not more than that. There's too much fat and too much protein and too much salt in there, all right? And this is another one. Is this healthy or not healthy?
What is that?
What is that?
Edamame. Edamame.
Huh?
Edamame is healthy.
Yeah, this is not from Scotland, okay? This is from Japan, and it's widely available now worldwide, right? What is unhealthy there? You
Are
can
there
see
peas?
something there, right? It's green
Are
in
there
color,
peas?
but there's something on top.
Salt on top.
Yes. So someone saw that. So these are the twinkle, twinkle, little star. You should not be eating all the time. So whenever I go to a restaurant, whenever I order this, I will tell them no twinkle, twinkle, little salt, please. Okay, no salt at all. So when you order your chips and ask them no salt, please. And then this is where you learn to unlearn the acquired taste. You see, learning how to dislike salt is an art. If you can really stop using salt all the time, your tongue will get used to it after 3 months. So this can be learned and unlearned, the taste. All right? Same thing for sugar. If you are someone who likes sugar, again, if you are disciplined enough, you try hard enough, after 2 to 3 months, you'll begin to dislike it. So today, if I go to a restaurant, I ask them, no salt, no oil. They will look at me with one funny look, but after a while, they'll recognize my face because I always go back to the same place and then they will cook the way that I want. And of course, you have to recognize the restaurant that will do your liking. Some of them may not like you, they may ask you to go home, right? So this is what I've done. This is where anyone recognize the country that use a lot of bicycles?
Denmark.
Denmark, yes. And another one?
Holland.
Holland, yes.
Finland.
Okay. Yeah, the Netherlands. This was when I was speaking in Holland, Amsterdam, okay, a few years ago. You can see that if you park your bike there at 9 o'clock, how are you going to find your bike at 5 o'clock? But they encourage people to bike, to ride. But this is the trademark of Holland, okay, the Netherlands. And I find that this is very, very important for people to regularly do so. Because even if you don't do this for your high blood pressure or your diabetes, you must understand regular exercise help you to have healthy aging. We cannot avoid aging, but we can aim to have healthy aging. So this is what you need to do. And studies have shown that if you regularly exercise, not only you are less likely to be institutionalized, meaning you are less likely to go into a nursing home or a residential home because you are less likely to fall. So if you work on your lower limb muscles, because the lower limb muscles are bigger, your leg muscles are thicker. So if you work on them, you are likely to be able to maintain your coordination better. You are less likely to fall. Hence, you are less likely to have a hip fracture and hip surgery, and you are less likely to be sent to a nursing home. That is why working out, regular exercise is very important. How many hours did I say earlier to exercise? 2 hours, 3 hours, or 4 hours per week?
3 hours a week. 3 hours a week.
Yep, good. 3 hours is, if you forget about it, 3 hours is good. Of course, if you can do 4 hours, no one is going to stop you, right? The key thing is to make sure that you do moderate intensity exercise, not too light and not too heavy, what your body can take. Especially for people who do not regularly exercise, it is important to start now and start slow first, right? And it is important for my dialysis patient, this is what I have taught them, right?
You haven't mentioned about Ajinomoto, which is very popular now, high salt content. Ajinomoto.
High what? Sorry, high?
Monosodium glutamate.
Oh,
Mono.
yes. The MSG is your enemy. Okay? Salt and MSG, they are cousins. You need to stay away from them as much as you can. And including the soya sauce, the oyster sauce. So very often I tell my patient, right? If the food looks delicious, just look at them, don't eat them, right? If the food is not delicious, chances are it may be healthy for you. So a lot of patients will look at me and say that I think I'm telling them gibberish. But in general, that is the rule that I say if it's too delicious, most likely they have too much MSG, right? Now, you see this patient of mine, and you see me standing there, sitting there on the bike. This is what I call dialysis kinesiology. In Asia, it is not popular. When I first came back to Southeast Asia, to Asia, most people told me it's too laborious. They don't know what is this dialysis kinesiology. It's basically my patients that I encourage them. When you are doing dialysis, because it's 4 hours per session, you need to put your legs on the bike. You need to do regular exercise even when you're on dialysis so that the clearance is better. When you do regular dialysis, you will build up the lower limb muscles. You are less likely to fall. And the other option is to use tight band. You see those elastic band that I'm holding there on my right arm? Yeah. So this is an example where you train the muscle to have strength training and also stamina. And but this is one thing that is very difficult to carry out. Many people do not realize exercise is a form of medicine. It is just something that you do not take by in the tablet form or injection form, but actually it is a form of medicine. And to motivate people to do that, you really have to repeat the slogan again and again, right? And so these are the benefits. Okay, same thing for dialysis patient or non-dialysis patient. When they do so, a lot of patients often tell me they feel less tired after dialysis. When they do not exercise when they are doing their dialysis session, even after one session, they will feel the difference. They will have a lot of body pain. They'll feel very tired. And the quality of life will significantly deteriorate if you are a dialysis patient and you do not exercise, right? And this is where you can get more details about my book. Okay, I'll show you the link in a minute. Okay, this is translated now to other languages. Let me see you. Okay.
Doctor, doctor,
Yeah.
if if the heart rate go very fast, like 180 per minute or 170 per minute, although
Yeah.
just lifting up their leg on the bed only to exercise then how to have moderate even that is considered as moderate already because the heart rate raising
So this
because I
person
got
must have medical problems, correct?
autoimmune problem yeah.
Yeah. Yeah, I'm
So the
talking
heart rate
about
also
the general population. I'm talking about the general population. I'm not talking
okay.
about people who have illnesses. If you have a particular sickness, you have a particular illness, you need to check what you should be avoiding, what you should eat, and your exercise regime. All this you need to double check with your doctor. I'm talking about the general population. So if you tell me this person generally have very, very fast heart rate, even with the slightest move, there may be something that is wrong. He may not be suitable for all the routine exercise that most people have, right? Let me tell you this one first, okay? So, yeah, these are some of the pictures in my book that I'm just going to show you here. You can download the first chapter about hypertension, very easy to read, free of charge. You go to this link, you can get this there. And that's if you have more question about high blood pressure. And someone was asking me about the sodium intake or protein intake earlier. And so some of the things that I tell you is in the pages here, right? Yeah, but that's a good point. If your heart rate is very fast or your blood pressure suddenly drop, even with the slightest movement, then there's something wrong with you. You're not a normal person. So you shouldn't just adopt the normal pattern. You may need a custom-made regime, just like a gym instructor need to go through with you and see. If you constantly have back pain, you constantly have leg pain, knee pain, they will modify the exercise classes for you. You guys
Is
are
the
fine.
cholesterol, I want to ask, is the cholesterol, high level of cholesterol, and can also increase or blood pressure, because cholesterol can go to your arteries and later on you form not only diabetes, also high blood pressure, and also stroke also definitely, and heart problem also because of high cholesterol. Like WHO says, I think above 5% actually is considered to be a fatty liver.
Certainly, high cholesterol is something that you must pay attention to. In general, if you have diabetes, the guideline in Malaysia is after the age of 40, you should be put on a cholesterol tablets. The idea is to reduce all the risk factors as much as possible. Okay, if you have cholesterol, high cholesterol, diabetes, and high blood pressure, these are triple combo. They are important risk factor that you must control fast. The possibility of cholesterol causing high blood pressure is not very a clear association. That maybe a minority of the people are like this, but the combination of these two factors are not good for the body. So regardless it causes it or not, you need to control that. Whether the blood pressure is causing the high cholesterol or the high cholesterol causing the high blood pressure, both of the risk factors need to be controlled regardless.
What about heavy dose of statins that they give us to control the cholesterol? Would that affect the kidney?
Whoa, okay. You guys saying heavy. How heavy is heavy? How do you
I
know it's
mean,
heavy?
they say 10 milligrams. Sometimes they put you on 40 milligrams of statin.
40 milligram. Are you a doctor? Yeah.
Yes, and I am on 40
Yeah,
statin.
yeah. No. 40 is the standard dose. So if you look at the proper medical studies, they have tried it before for the UK heart protection studies and a few other relevant studies. They say, especially if your heart, you have already had a heart attack, you should be on the standard dose 40 first. Okay. There may be some of them that we may reduce in due course when the person is more stable, depending on the result. But 40 is a pretty much a very standard dose, especially for people who are at high risk of having a heart attack or stroke. So it's a safe bet. You can reduce it to 20 for those people with primary prevention. For primary prevention, you can actually start at the lower dose. But for secondary prevention, meaning the person already had a stroke, the person already had a complication of high cholesterol, you need to be serious and bring it down quickly.
Thank you.
Sometimes they may even give you 80 milligrams in certain circumstances.
Oh.
Cholesterol tablets generally do not cause kidney failure. All right, it is a myth that many people think. There are a minority of the people that may suffer the complication of cholesterol tablets because of muscle damage, what we call myositis. So some people cannot take a high dose of cholesterol. They will complain of muscle pain, and then the next thing they may complain is they may get dark urine, meaning there's too much muscle damage in the urine, and therefore the kidney may be affected temporarily. So this is usually reversible. This is a side effect of the cholesterol tablet that you need to stop, talk to your doctor, and then after that, he may reduce the dose or change it to a different brand or a smaller dose. That's all.
Thank you, Dr. Ken.
Dr.
Sure.
Ken, I have a question.
Ah,
After
you guys have
coming
a
back, after coming back from the gym, having 6 gram of keratin, does it affect the kidney or is it okay?
Try to stick to 3 to 5. Creatine is generally a safe product. Generally, say there are a few studies in the past that have shown that, and then some say that you may get hair loss. The study that causes hair loss is not a very, very good study. But in general, creatine is a very, very good drug. It helps you to do more workout. You will notice that if you take creatine before you do the gym work, you can actually do more work, and you can lift heavier because it is actually an energy supplier. So basically, it is something that will supply you extra battery, extra electricity to do your workout. So in general, it is a good thing as long as you do not have other medical problems. If you have severe kidney failure and all this, then you need to talk to your doctor.
Okay, so you mean to say to take keratin, it has to be before the workout, and then after the workout is whey protein, right?
In general, that is the case, but it's not a must. If you want to take creatine after workout, it's also okay.
Okay, thank you very much, doctor.
Okay, no problem. So, all clear now. Everyone has perfect knowledge about your kidneys now, correct? And everyone will be able to keep your kidneys going for another 200 years from now on. Yep.
Dr. Ken, I have a friend. I sent her the link. She could not join, but she had some kind of viral fever off and on, off and on. But a couple of months back, about 6 months back, she went for various kind of tests, and finally it was found that one of her kidney was totally shrunk, and it was not functional. And the other's kidney, recently 2 months back, when she went for a scan, has started to shrink. Is there any particular reason for it, and is there a possibility that it can be resurrecting again?
Okay, so how old is your friend?
She must be 40.
40. And has she had any kidney problem before in the past?
Never, never. So one of the question is, what are the symptoms? Because she was surprised that her kidney was shrinking.
Most of the time, as I said earlier, that people with early kidney problem absolutely do not have any symptoms. Most of the time, when you have symptoms, you will be actually quite severe. The damage is quite severe, and they may come in the form that the symptoms will be swollen legs. Sometimes they may be very, very tired, poor appetite, and then sometimes they may get very high blood pressure. There are all kinds of non-specific symptoms for kidney failure. But in the early stage, you usually do not have symptoms.
Does COVID have any effect? People who have had COVID, people are becoming a little weak? Is just
No.
a general question, not
Yeah,
because
I think
only she had severe COVID, almost near death experience, but otherwise she was very healthy.
Yeah, severe COVID in those days that we see in ICU, they usually, if they're going to have kidney problem, they're going to have kidney problem almost immediately. Those are severe kidney failure patients that have very, very bad COVID in the early part of 2020. Those are the ones that they may get kidney failure, and they either survive or they don't survive, basically. But it's not like you're going to have COVID now and then 2 years later, then only you have kidney failure because of your COVID infection now. It's not likely to be connected.
What should I avoid taking if I got kidney stone? What to take and what to avoid?
Okay, the key thing is actually if you have kidney stones, number one, make sure that you drink enough water. Number two, if you can find out what type of kidney stones is useful. So, for example, if you have uric acid stone and you get gout all the time, then you should be on a particular tablet to reduce more stone formations in your kidney. So, people who have uric acid stone in the kidneys need to take a particular tablet. Okay, and thirdly, again, moderation. Your diet has to be careful. If you get calcium oxalate stone in your kidneys, then you need to reduce your tea drinking. So these are the few things that you need to do. And one particular fruit that every dialysis patient we always tell them to avoid, especially if you have severe kidney failure, is star fruits. Okay, don't take star fruits, not even a little bit.
You mean don't take star fruit if you have kidney stone?
No. Star fruit for kidney failure.
But kidney stone okay lah.
Yeah. Okay.
I mean,
Not too
sorry,
much. Okay.
sorry.
Yeah.
I'm
Okay.
talking about if kidney stone okay, take star fruit lah, huh?
Yeah. A bit is okay, no problem. Okay, but don't take too much. Okay, I always encourage people don't take too much. That's a message for them to get it. Okay, but for kidney failure patient, do not take star fruits. Okay, and durians. Okay, durians is a very sinful fruit. Okay.
How much protein we should take actually? As per the study says, which we know, that it is like your body weight into 0.8. And suppose if you are working out, and then it should be like into 0.10. So into your body weight. So that must be the regular protein intake for your body. But to compensate even this much also, even for egg also 1 egg 6 gram protein, and even with other gram flour, rather than avoiding using all this gymmers products kind of thing, no, there is also I've heard side effects are there actually. So better to use your original protein actually from the natural source if we are able to get it.
Okay, someone already asked that question. We talked about it. So the range of it depends on your activity and what you are doing as well. Yeah, roughly 0.8, 1 gram, and so on. Some people even say 1.2 gram. But in general, if you can adopt the approach of going for natural protein, is even better. We talked earlier about chicken breast and fish. All these are better protein source than red meat. But red meat is also a good source. Beef, mutton, all this is okay if you want to take them. But in general, I always advise people fish and chicken are very good.
How about pork? Pork.
Yeah, it's okay. You can take pork. Yeah. I will not discourage you from taking pork if you want to take pork. Okay. I think a variety of food is important. But what is important now for us to know in Asia, okay, whether it's Malaysia, Singapore, or Thailand or India, I think we tend to have a lot of carbohydrate based diet. We have a lot of noodles, a lot of rice, a lot of bread. That sort of eating. We need to slowly change our mindset. It's like you need a balance of vegetables, carbohydrate, fat, and so that you can actually not torture your body, your kidneys, and your liver to work in just one particular direction. Balanced diet is what you need to do. Okay, and I think, and don't forget about exercise. That's the key thing. Input and output. If your input is very high and you sit at home and watch TV only and eating popcorn only without output, then of course this will lead to your downfall. Your input and your output both are very important. Calorie in, calorie out.
Thank you, Dr. Ken. It has been so interesting. I think we should have you again because so many are interested.
Yeah, I was about to tell you I will come back just before Christmas to remind everyone not to eat too much. But then maybe I'll come back next year and then I'll tell you what are things to do, and then we can discuss again about other topics.
Yeah. I think we should have one more session with you because it's been so interesting, and you take such simple questions too and clearly, clarify everything to us. I'm very grateful to Dr. Ken for having come all the way from Malaysia and given us his time in spite of his excellent, practice and knowledge. Grateful to Dr. Meghanathan from Malaysia to invite Dr. Ken and introduce him to us. Grateful to uh, Priya Aristotle, who is the Supreme Court advocate of India, who's been with us opening the show, helping you with the screens and guiding us. And to Sister Smita, Sister Anita, who always help us with the Bless India program. Thank you all so much.